in countries like ours, because of the limitations of our fiscal space, it's often very difficult for government to make difficult choices. Do I invest in education or health? Do I build a road or a school? And that is, of course, one of the biggest challenges we face. You should not have to choose. Do you send children to school, or do you make sure that every single individual has access to basic services and healthcare? And again, as the ED has said, today with regards to HIV/AIDS, we know what works. We have an abundance of knowledge and lessons learned. We have the interventions that can make a difference. Usually, what you're going to see, the challenge is making sure that two things: the governments have enough resources. Second thing, that we have the appropriate amount of data so that we can make sure that the services are reaching the most vulnerable and the most at risk. And this has to be, of course, a deliberate act. So funding is critical. With regards to the global uh, environment, with funding in general, as you know, the global community is going through a very challenging time now, and that puts funding for all these different interventions at risk. Now, fortunately for us, we have real serious advocates and partners that are committed to making sure that funding for HIV/AIDS does not go down. And this is one of the purposes of the visits like the ones we have today. It's to be able to remind governments, remind stakeholders, remind the private sector, remind individuals that despite the big progresses we've had in HIV/AIDS, it's still very much present. Millions are affected every year. We cannot let our guard down. This cannot become a marginal part of what the international community commits, and we need to continue the fight. And as you well know, those of you that are researchers, no one has been a bigger advocate for this on the global scene than the ED of UNAIDS. That's why we're so happy to have her here.
Community systems are very important in responding to HIV. And in Jamaica, specifically, we have the JN Plus. You know the JN Plus? Yes. They are driving the frontiers of community-led monitoring. As UNAIDS, we are working with civil society to develop community-led monitoring strategies because when COVID struck, we used the lessons in HIV to support community responses for COVID. And through that, Global Fund and PEPFAR are investing and supporting civil society to ensure that communities are at the center of the response. So people living with the disease, because they know what it is, are the people encouraging their peers to have access, show them where the services are. So accessibility, affordability in terms of, and what is beautiful is that the government of the Jamaica doesn't charge people for treatment. So if you have it, you have access free, unlike in other jurisdictions where there are user fees, So the JM Plus is working and ensuring that treatment is brought to the doorsteps of people. And one very important thing that they do, when there are people who are lost to follow up in care, they are in that engagement trying to bring them back into care. And taking medications is a challenge. Even though it's one pill a day, some people become fatigued in terms of taking medications every day. And so they encourage in terms of getting adherence, helping people to be adherent to their medication. And I think community-led monitoring is something that the government has bought into. And Winnie was engaging with the Honorable Minister of Health. And Honorable Minister of Health says we want to go down the route of primary health care, sending treatment to the doorsteps of people. And we need civil society, community health workers to help in that arrangement. So basically that is what is happening, which is good news for Jamaica, and UNAIDS is happy to be supporting the communities to be able to send treatment and prevention services to the doorsteps of people who need it.